Most seniors pass away within a few years after turning 70. Doctors say these issues are the main reason. Aging is an inevitable part of life, but for many seniors, especially those who cross the age of 70, it marks the beginning of a rapid decline in health. It's not uncommon to hear stories of people living vibrant, active lives only to face sudden health challenges after 70. This pattern is so consistent that doctors and researchers have taken notice. Studies reveal that a significant number of seniors pass away within a few short years after reaching 70. This isn't just coincidence or fate. There are specific, identifiable factors behind this concerning trend. Understanding these factors can help seniors and their families take proactive measures to extend not just life, but also the quality of those extra years. Aging, of course, comes with natural wear and tear on the body, but the steep decline that occurs after 70 is more than just getting old. Research from institutions studying senior health shows that several key health issues play a major role in this trend. One of the most critical issues is cardiovascular health. The heart, which has been pumping tirelessly for decades, begins to show signs of exhaustion. Arteries may harden, blood pressure rises, and the risk of heart attacks or strokes becomes much higher. Data from a study published in the Journal of the American Heart Association reveals that individuals over 70 are twice as likely to experience heart emergencies compared to those in their 60s. This sudden increase in cardiovascular risk is one of the top reasons many seniors face life-threatening health situations after 70. Another major reason for the decline in health after 70 is the increased likelihood of chronic diseases turning severe. Conditions like diabetes, arthritis, and respiratory issues tend to progress to more dangerous stages if not managed properly. For instance, diabetes often leads to complications like nerve damage, kidney failure, or severe infections, all of which become harder to control with age. Arthritis, on the other hand, can reduce mobility to the point where physical activity becomes nearly impossible, and without movement, other health issues arise, like weight gain, muscle loss, and reduced lung capacity. One large-scale study found that seniors who were unable to engage in light physical activity due to arthritis were 3 times more likely to engage in other life-threatening conditions. These ripple effects are a hidden danger slowly leading to a chain reaction of health issues. The third key issue affecting seniors after 70 is cognitive decline. While cognitive changes are common as people age, some seniors experience sharper declines that lead to dementia or Alzheimer's disease. These conditions are not just mentally exhausting, they can have a direct impact on physical health. Seniors with cognitive impairment are more likely to forget medications, neglect self-care, and experience confusion that leads to accidents like falls. Falls alone are a major contributor to early deaths in seniors. A fall injury like a hip fracture can turn fatal if complications like infections or blood clots arise. Shockingly, 1 in 4 seniors over 70 who suffer a hip fracture will not survive beyond 1 year. This connection between cognitive health and physical health is one of the strongest indicators of why so many seniors face serious health challenges soon after crossing the 70-year mark. Knowing that cardiovascular disease, chronic illness, and cognitive decline play such a significant role in senior mortality is unsettling. But it's even more concerning when you realize that many of these issues can be prevented or slowed down. The problem is that most people assume these issues are just part of aging and accept them as unavoidable. This mindset prevents action. Many seniors delay doctor visits, ignore early warning signs, and underestimate how quickly health can change. Even family members often see signs of fatigue, forgetfulness, or reduced activity as normal aging, rather than warning signs of something more serious. By the time they recognize it, it's often too late. Take cardiovascular health as an example. High blood pressure or high cholesterol can quietly damage arteries for years without any noticeable symptoms. A 70-year-old may feel fine one day and suffer a heart attack the next. The signs were there, but because there was no immediate pain, they were ignored. Data shows that nearly 70% of heart attacks in seniors happen without prior chest pain. The silent nature of heart disease is what makes it so dangerous. It allows the issue to go unnoticed until it becomes a life-threatening emergency. The same thing happens with chronic conditions like diabetes. Many seniors who have managed their diabetes for years suddenly face severe complications after 70. This is because the body's ability to heal and recover slows down with age. Small infections, cuts or wounds that used to heal within days now take weeks or even months to improve. For seniors with diabetes, these slow healing wounds can become infected, leading to physical impairments. Slow healing wounds can become infected and prevent them from regaining. The slow healing wounds can become infected. Inevitably, these worst cases lead to disappearances, lost jaws, leaky gums, burst bones. Research from the National Institute on Aging highlights that seniors with diabetes are 4 times more likely to experience life-threatening complications compared to younger adults with the same condition. Then there's cognitive decline. Many people think forgetfulness is normal after 70, but when memory loss turns into forgetting where you are, who people are, or how to perform simple daily tasks, it becomes a serious health risk. Seniors with dementia are twice as likely to be hospitalized and face a higher risk of infections and injuries. This isn't just a problem for seniors themselves. It also creates emotional and financial strain for families who must step in as caregivers. The inability to recognize danger, follow medical advice, or communicate symptoms makes cognitive decline a hidden but powerful driver of early mortality in seniors. The emotional impact of this reality cannot be overstated. Imagine being 70, thinking you have plenty of years left to enjoy retirement, only to face one health crisis after another. Imagine watching loved ones struggle with their health, feeling powerless to help. Many seniors become frustrated, isolated, and worse when their health suddenly declines. This mental strain can worsen physical health, leading to faster declines. Depression itself has been linked to heart disease and weakened immunity. Seniors with major depressive disorder are 80% more likely to develop physical illnesses than those without it. It's a cycle that feeds itself. Poor mental health leads to poor physical health, and poor physical health worsens mental health. Families are not immune to this burden. Children of aging parents often find themselves caught off guard when their previously independent parent suddenly needs daily care. They feel guilt, stress, and confusion about how to provide support. This sudden shift in family dynamics causes strain on everyone involved. It's not just the senior who faces the consequences. The entire family feels it. But this story doesn't have to end this way. Seniors and their families have more power to prevent these issues than they realize. While aging is inevitable, rapid health decline is not. The key lies in proactive health management. Doctors emphasize the importance of early detection, regular health checkups, and lifestyle adjustments that can dramatically reduce the risks. The earlier seniors and their families take action, the greater the chance of preventing life-threatening health challenges. For cardiovascular health, small lifestyle changes make a huge difference. Regular exercise, even light walking for 20 minutes a day, significantly lowers the risk of heart disease. Studies show that seniors who maintain regular physical activity are 40% less likely to experience heart issues. Diet also plays a crucial role. Reducing processed foods, sugar and sodium while increasing vegetables, whole grains and heart-healthy fats can lower blood pressure and cholesterol. This reduces the risk of a heart attack or stroke even after 70. Chronic disease management also benefits from early intervention. For seniors with diabetes, controlling blood sugar becomes a top priority. Regular blood sugar monitoring, a balanced diet, and proper wound care can prevent severe complications. Seniors should be encouraged to seek medical attention for even minor infections or cuts, as early treatment prevents escalation. For arthritis, physical therapy and low-impact exercises like swimming or Tai Chi can preserve joint mobility, keeping seniors active and independent. Cognitive health can also be maintained with specific habits. Studies show that mental stimulation like reading, puzzles, or learning new skills helps slow down cognitive decline. Social engagement is equally important. Seniors who maintain strong social connections are 50% less likely to develop severe cognitive impairment. Brain health is also linked to physical health. Exercise increases blood flow to the brain, supporting cognitive function. Finally, family support is essential for seniors navigating the physical and mental challenges that often come with aging. Loved ones play a crucial role in encouraging seniors to stay active, maintain a healthy diet, and engage in activities that stimulate the mind. Simple actions like inviting seniors for a walk, sharing meals together, or involving them in brain-challenging activities like puzzles or card games can have a significant impact. Physical activity, no matter how light, helps maintain heart health, joint mobility, and overall energy levels. Mental stimulation, on the other hand, keeps cognitive functions sharp, reducing the risk of memory loss or dementia. Regular check-ins are equally important. A phone call or visit from family members not only provides emotional support, but also allows for the early detection of health issues. Changes in mood, appetite, or physical appearance often signal underlying health problems. Catching these signs early can prevent them from escalating into more serious conditions. For example, noticing that a senior is suddenly more forgetful could be an underlying medical condition, potentially unable to prevent the untimely death of an employee, or permitting an unintentional weight loss may indicate an underlying medical condition. Families should also encourage routine medical checkups. Seniors are more likely to ignore symptoms, believing they are just part of getting older, but health issues like high blood pressure, diabetes, and heart disease can remain silent for years before causing sudden emergencies. Routine checkups help identify and address these hidden threats before they become critical. Loved ones can offer transportation, remind seniors of appointments, and advocate for their care. When families, caregivers, and doctors work together, seniors feel supported, seen, and valued. This sense of connection fosters emotional well-being, which is directly linked to physical health. With strong family support, seniors can maintain health independence and joy well beyond 70. In the end, it's not just about adding more years to life, It's about adding more life to those years. Seniors who remain active, engaged, and aware of their health can avoid the rapid decline that so many face. Instead of accepting old age as the cause of health issues, they can take control by focusing on heart health, chronic disease management, and cognitive well-being. Seniors can turn 70 into a time of vitality rather than vulnerability. The future doesn't have to be uncertain. It can be full of strength, purpose, and joy.